helping make your life easier. Moms Every Day.
Time now for Moms Every Day, everyone. With us today is Dr. Kristen Simpson from Simpson Dental Associates. Dr. Simpson, thank you as always. We appreciate you joining us.
Sure. Yes, glad to be here.
All right. So today we're talking about, dental implants. Let's talk a little bit about those. And if someone feels that they may need them, how do they know if they're a candidate for those?
Well, really all you need is to have enough bone in the area to have the implant placed. And the best way for us to be able to see that is by taking a CT scan. It's a three-dimensional image that allows us to see the height and width of the bone, so we know if there's enough room to be able to place the implants. So here's an example of some different views that you can see from a CT. And the one on the bottom in the middle lets us see the width of the bone to know if the implant will fit there. And then, of course, having enough height above, where the sinuses are and the nerves are will let us know how many implants we can fit in a certain area. And a lot of times people get nervous about a CT scan. They think, oh, do I have to be in a small space? Is it going to be hard to be able to get that image? And really, it's very simple. You're just standing up in the machine. The machine just rotates around your head, and it's basically just like a panoramic film, which is the same way that you would take that type of dental image. So it's really simple to get that image taken.
Dr. Simpson, we've talked before too in our segments about your Teeth in a Day program. That's what you're known for. So tell us a little bit about, though, for people who may have not seen that, what is the Teeth in a Day program?
Well, the Teeth in a Day is it's a specific procedure for people that are missing their teeth and need implants to support a denture. A lot of times lower dentures can move around when you're biting and chewing. So what we do is we place 4 implants on the bottom arch, and we're able to connect them with the bar and then put clips inside of the denture that clip on top of those implants. So what we do is we have the denture ready for the day that we do the surgery. You come in the morning, we place the implants. We take some impressions for the lab to be able to connect that denture to the implants in a single day. So it really helps that we have the lab in our office to be able to do that procedure, to have the denture ready by the afternoon for you to go home with it implant supported.
And how do you go about deciding how many implants that your patients need?
Right. Well, it just depends on how many teeth they're missing. If it's going to be to support a certain prosthesis, we always try to over-engineer things to have the right amount of implants to support the space that we need. If it's on the upper arch, that bone is a little bit weaker, so we might need additional implants there. If it's just to replace a single tooth, you only need the single implant. If you're replacing multiple teeth, you might just use an implant bridge. And you want to make sure that you're getting a traditional type of implant and not a mini implant. So, and here's an example of the different ways you can use those implants as a single tooth or to bridge them together to replace multiple teeth. So it just kind of depends on what the scenario is for each person.
How do you go about determining if it's best to try and save the natural tooth that's there or just placing an implant?
Well, we always try to save the natural tooth if we can, but sometimes the natural tooth can be, too broken down to where it's too compromised to be able to save it. But if it's possible to save it with doing a root canal and a crown on the tooth, that's always the best thing to do. If you're having bone loss around it because of gum disease, you might end up losing the tooth and needing to have implants placed. But you want to make sure that you keep those gums healthy, because the implants can, be affected by the gum disease. So they need to be taken care of to make sure that that bone support around the implants is healthy.
And Dr. Simpson, here's the all-important question that a lot of people always wonder. How much is a dental implant, and is insurance going to cover it?
Right, yes, that is the big question we get a lot. People want to know how much it's going to cost, and of course it's variable from person to person depending on what they need. And as far as dental insurances, they really don't cover dental implants. They consider it cosmetic, so they don't really want to cover those types of procedures, and they want to cover a lesser procedure like a partial or something to replace those teeth. So you're looking at about $1,500 for a single implant. So depending on how many implants you need and what's going on top of them will let you know what the final price is going to be. So we really need to get that CT scan to be able to get you a good treatment plan together.
All right, Dr. Simpson, well, thank you so much for joining us, and thank you all at home for joining us. Have a great day, everyone.